children because it is so prevalent and it is growing. Now, you may not be aware of this, but it is really posing a great threat. And we're going to be diving into it, and I hope you're ready. Tighten your belts. We're going to dive into it. Doctor, good morning.
Good morning.
Happy New Year.
Happy not yet. Happy New
Year. Abantu byo bakitya fe wano twatandika okukuza Christmas nga tumugwa 10 nga twete twayingidde dda mu mood twayingidde dda tukkiriza Katonda nti bigenda kuba bulungi. Doctor, let's kick it from here. What is osteomyelitis?
Osteomyelitis is a bone inflammation because of infection.
Okay.
Yes, usually it is mostly bacterial infection.
Really? Just bacterial infection?
Yes, mostly. That the bacteria are mostly the microorganisms that do infect bones.
Okay.
And they are the most cause of what? Osteomyelitis.
Okay, and if you call it a bacterial infection, that means all of us are prone to that. Where do we find those bacteria?
Bacteria, usually, it's not that everyone is prone, because it is usually after when your blood has come in contact with what? With the bacteria.
Okay.
Then, because blood will go, circulates through the bones, then after it will transfer that infection inside the bones. Then the process of the infection to affect the bone will start to do what? To move on.
Okay.
Yes.
Wow. Why is it so much common nowadays, and why is it so much in babies?
Yeah, it's so much in babies. I don't know why, because babies are the most being affected, mostly children. Those ones between 4 years, between 4 years and 14 years, they get affected. That's the age bracket that usually you find that osteomyelitis to be very common.
Now, with every disease or every challenge,
yes,
of course, there is no smoke, they say, without fire. What could be the causes of this?
The causes of osteomyelitis. The main cause of osteomyelitis is what? There are bacteria called Staphylococcus aureus. Now, that Staph aureus is the most common cause, that bacteria. But then the risk factors, that how can someone come in contact with that bacteria, the Staph aureus? That you find that there are many things that will expose you to that Staph aureus. Mostly, those kids who have had a post-surgical history, they are prone to do what? To osteomyelitis.
Who have had surgical history?
A surgical history.
Okay, what do you mean by that, surgical history?
That sometimes you never know when they're operating, that Staph aureus got its way in, either through the surgical instruments or any other thing that was part of the procedure.
Now that makes it more complicated, because most of our children, they are circumcised, especially male. Now, does that justify actually the reason why it is more common in male?
It is a risk factor. That means that that someone can survive it.
All right.
Someone might be lucky that there was no infection that took place. But when the surgery or when the operation was 100% sterile, which is rare. Then another thing is what? The infusion. If I told someone is being infused with like a normal saline, okay, through cannulas. Yeah, through cannulas. Remember that kids, sometimes you will put a cannula even to you, the adults. You find that they will put a cannula, but then after sometimes the bacteria or microorganisms can easily do what? Enter. It depends on the hygiene of the kid, that these microorganisms can easily come in contact
actually
with the blood.
One time I was hearing Dr. Yidro Richard. He's a pediatric consultant at Mulago Hospital.
Yes.
And was discouraging cannulas especially when they are inserted in people and they're left to go with them, or mobile cannulas. I was like, actually, your veins are open, to bacteria. So just use a cannula, administer drug on the person, remove it, dispose it, as opposed to many people now it's like vogue, it is a norm. Someone they administer cannula on them, drug on them, and they are moving, and I think that one is posing a great threat to health.
Yeah, true. Yes, then also wounds. Through a wound, bacteria can enter through a wound, then they will go into blood circulation, then the blood, through the blood circulation, they will easily reach the bones inside. Then there is the cuts. If at all someone has used any, because these sharp objects, you never told whether it is having a microgram, but it's very rare that they are not having. You find that those bacteria can be there. This kid or any person uses that object, injures him or her, then you find that it will do what? It will insert bacteria inside. Then once they go into blood circulation, they can easily reach the bones.
Yeah, doctor, if you've just joined in, you're watching Health Morning, and we are in focus. Our lenses are shifted to osteomyelitis in babies. It's a disease infection, and I'm with Dr. Moise here. He's an orthopedic doctor. We're discussing the risk factors, people who are at risk of getting this infection. It is really posing a threat in babies, children between 4 years and in between, as the doctor was saying. So you parents, you might want to listen to this and keep your eyes on Bethany. Yes, doctor.
Yeah, so those are some of the causes. Then even others, like maybe at birth, but that one is very rare. Where a kid is affected by bacteria at birth.
Oh,
yes.
So that means when a child maybe falls down and they get a wound, or maybe they have a cut, parents should be so careful. But I think also the hospitals where we go, because some instruments used in surgery are not sterilized. Even the people who carry out circumcisions,
so some procedures end up not being sterilized.
Musajja ali awo seeka n'omugwako ng'olumu netutagenda mu malwaliro naye anti olumu batugamba nti be bamanyi omulimu ogw'okusiiga abo mu malwaliro kati simanyi butuufu bwekyo. Anyway, doctor, my other question would be how do we treat bone infections?
How we treat bone infections?
The treatment bit.
It's a bit a larger process that we go through to treat those bone infections.
Are there vaccinations? Are there injections or whatever?
Yeah, there are injections. There are injectables. There are also oral drugs that someone can take. But it depends on the stages, because osteomyelitis has stages. It has.
Maybe before you go to treatment, we go to the stages.
Yes, we can go to types.
Okay.
There's what we call chronic osteomyelitis and acute osteomyelitis. In acute osteomyelitis, we find that it is the early stage of this osteomyelitis. You find that in acute osteomyelitis, it can start as polymyositis. Polymyositis is like a muscle infection. Then after a muscle infection, that these microorganisms will then reach to the bone. You get when they can easily affect the bone. Immediately you find that someone is feeling severe pain. You find that usually the signs in acute osteomyelitis, find that there's a swelling of the part that is being affected. Usually osteomyelitis affects mostly the long bones.
Yeah, maybe producer would give me those pictures of what doctor is trying to explain, that the people may really get exactly the thing.
Osteomyelitis usually affects long bones. The long bones, those are the femur, tibia, fibula, ulnar radius. Those are the long bones of the body. In adults, usually affects the spines.
Okay.
Yeah, but in mostly in kids and even maybe adults who have had those past when the infection was to either to fracture, usually those open fractures, trauma in those open fractures can easily lead to infection. Infection can easily enter through the open wound,
okay,
then to the bone. So you find that this infection in acute, the limb will swell, or the part that is being affected. Sometimes when we are doing a clinical examination, we do use a syringe and we do what? Or we try to aspirate. We inject inside and we try to aspirate.
What is that?
Aspirating is like you confirming whether there is pus. Because in osteomyelitis, whenever there is a bacterial infection, you find that there is a lot of pus. So we do inject a syringe in that swelling. Then we try to pierce to see whether there is what? There is pus. Then even when you see there is pus, we can take that pus to the what? To the microbiology lab for culture to see which kind of bacteria that is present. You get to try to differentiate. Now that is in acute osteomyelitis. There's usually swelling, then that pain and tenderness. You find that there is a lot of swelling, then pain on palpating, then warm. It will always be warm. Whenever there is a bacterial infection, the swelling is usually what? Warm. You find that it's very hot. You get. So after someone will be having fevers in acute osteomyelitis. You find someone will be reporting fevers, night sweats, because of the raised temperatures. So those are the signs of what? Acute osteomyelitis. When we are doing after realize that it is acute, usually we can give just oral medicine, and then also you do what? Aspirate. You aspirate, you drain the pus, then you give oral medicine or antibiotics. But after there is what we call chronic osteomyelitis. That one is the most common one, the chronic one, because usually people neglect the primary stage, the acute stage.
Okay.
Usually there are those who think that it is a talo. Then they neglect it.
I thought that is also a bone infection, a talo.
Yeah, it's a talo. That's pyromyositis.
Oh.
Yeah, what they call a talo. For us, we take it as pyromyositis. It can be because pyromyositis is like a muscle infection.
Okay.
Then osteomyelitis is a bone infection. Then the psoriasis, those are kangambe infection nenga etandikirwako usually ebera ku these tissues, not muscles but the other tissues, not muscles nor a bone. So kati abantu abamu buli wafuna eyo swelling agamba olusi it's ettalo oba eddogo.
Nenga olumu si kyekyo.
Yeah, it's not that, because that is always a bone infection or a muscle infection or a tissue infection.
Yeah.
When in chronic osteomyelitis, then the signs of chronic osteomyelitis, that one is the most complicated one, and it has a lot of deformities. It causes a lot of deformity to the part being what? Being affected. In chronic osteomyelitis, someone will report with severe pain. Usually we notify that it's chronic osteomyelitis. You find that there is a hole. It makes a sinus. It will make a sinus at the part that is being what? At the part of the leg or the hand or the bone that is being affected. You find that it makes a sinus. The sinus comes because whenever a bone is swelling and is affected, whenever the bone is affected or infected with bacteria, it will make a pus. Then when pus is continuously being made, you find that that pus will accumulate inside, then it will go to the muscles because of the increased pressure inside. It will go to the muscles, then it will always find its way out. So we'll find that it will then affect the muscles to make a hole so that it can easily get outside because of that increased pressure inside. So in that instance of getting outside, it will make a sinus, a small hole where it will find its way outside. Yes. So another thing in chronic osteomyelitis, the bones will be, you'll find that the bone has started dying, what we call necrosis. The bone cells will start dying. Okay. That you find that the bones, the bone will call what we form a sequestrum. A sequestrum is like a dead bone. So the bone will start dying, and you find that those pieces of a bone will start getting outside through that through that sinus that was formed before. This person who is having chronic osteomyelitis, you find that hole pus will be coming out on a daily basis with those dead bones. Then when such people come in, what we usually do, we do a test, because we can easily get a swab from that pus that is getting outside. So we get a swab, then we take to a microbiology lab to do some investigations to find out which bacteria, what and what, like that. Then also recommend for the X-ray. X-ray, you will get a good picture of how a bone is looking like. If at all there is any abscess still inside the bone, if at all there is how severe was the bone affected. Usually in chronic osteomyelitis, you'll find that even the bone has started getting fractures. What we call, those are pathogenic fractures. Pathogenic fractures, those are the fractures that are just caused by infection. Because the bone is being eaten by these bacteria, you'll find that it will easily do what? Break itself without any force on it, but it just breaks easily. Those are pathogenic fractures. So when we do the X-ray, you find that X-ray findings, you find that there are multiple sclerosis. Like the bone is like, if at all you have manye chisoli nga chitiridwe wenkuyege oba that gundi yenjuchi ebiyumba byenjuchi, you find that the bone is in that format. Ojja kwesanga nga
liringa eririmu ebitulituli
nga amagumba galiribwa. So in chronic, you start even see, you will see even the pathogenic fracture I've talked about. It will be among the features of the X-ray findings in chronic osteomyelitis. Ngegumba litandise okubanga limenyeka lyokka. So ojja kwesanga nga mulimu gundi, there are dead bones, those sequestrum. You find that kwebuli nga mulimu obugumba obufu kugumba. Certainly, in chronic, you start that there are new bones being made. Whenever there is a fracture inside, whenever there is a fracture, obanga egumba liribwa neddala eppya lifuluma libanga kiro ndokwa nti wotema ettooke nti wabaawo ate omutunsi omulala ogufuluma. So it is the same in bones. Nti wana amagumba ampya amakadde gaba gatandika ovaawo, even the new ones will start forming. So wajja labawo a new bone, then even dead bones ojja booziraba. So those are the features of chronic osteomyelitis. Kati since after seeing those features, we tugendera mu management netulaba how can we treat, how you have dreaded nti kati ono akyali mu acute stage because there is no sinus.
Okay.
There is no
sinus tukisetya mu Luganda.
Sinus
amabwa.
No ebbwere erikolebwa nti kibanga kituli nti lipase webanga whenever passes has accumulated inside
amasira wegaba geyongedde.
Yes. So it will always find its way outside. There will be an increased pressure munda. So it will always find its way outside. Ojja kulaba nga wakoze engeri ya katulututu, then after through that katulututu it will burst so that this pus can get outside. So then it leaves that sinus. That sinus usually it goes abantu when it is too severe it can even make 2 sinuses. Yes.
Obutuli ne bujja bubiri.
Ne bujjanga bubiri.
Obutututu obwo amasira ne gafuluma. Kati eri munda waliwo ekiba kigasindika mufulume temulina kubeera wano.
Olwa pressure eba increase munda nti mangi. So they will always look for the air outside.
Kati ako kabonera akalaga nti waliwo ekikyamu ekiri munda.
Manya waliyo ekikyamu ekiri munda.
So omuntu takanyooma. Nafunye wano akatulututu biki.
Waliwo obutulututu kati buno obutulututu osteomyelitis era omuntu ajja ekizimba wekituukiro yabika nga almost it is in 8 months.
Wow. Ate n'obulumi buba bungi.
Yes, because kiba ekigere kyazimba oba oluusi bo ne batandika otambula usually because I've always seen clients who come in with osteomyelitis.
Basawo b'ekinnansi oba ne bafunako herbalist oba ne bamugamba agende ku nsika afuneyo ku ddagala eri asigewo kamulali.
Yes, because I've always seen usually naddala nga bava mu byalo
birabika bulala omuntu asobola okuba bw'atyo.
Yes, in osteomyelitis asobola okuba bw'atyo. Wow. So kati ekizibu bwe kiri nti abantu sometimes are believing nnyo in juju. Because I've seen kids abamu naddala people abadde nga bavudde mu byalo when they are coming for medication osteomyelitis nga oba they have moved ebintu biganye. You will see that site eri affected kuliko engeri y'obuntuntu basalasala obunyirita
basazeko bamusigeko eddagala
bamuteekemu eddagala. So I've always seen that in at least some clients have seen.
Abazadde bakkiriza nnyo mu kweraguza dogodogo ebyo biki kangendewo omusawo w'ekinnansi. Okay.
So ate no ebintu byennyini ate byongera ku infection. Because someone is cutting with a leather blade.
Yes.
But you don't know whether this leather blade ekolebwa ku bantu benkana wa.
Tomanyi na ne wasala. Bwasala omusuwa.
So ebyo nabyongera ku infection.
Abatulaba tulina Dr. Mwesi musawo w'amagumba twogera ku bulwadde obukosa amagumba mu baana. Bweyongedde nnyo ennaku zino ensangi zino ate abantu olw'obutamanya ne bagenda mu basawo b'ekinnansi. Omusawo w'ekinnansi takugukangako mu kubaaga, takugukangako mu kulongoosa, tayina bintu bitereeza bisterilize nga byoza byuma byakozesa. Akwata kagirita n'asala omwana. Mwana nge bamuloze ayina ettalo salooko waggulu siigamu eddagala. Tomanyi na girita gyakijje kati n'osajjula embeera. So abalaba Bethany enkyaleero kikulu nnyo okwegendereza ate amagezi maanyi. Tutera okugamba nti ky'otamanyi kye kikutta, ky'omanyi tekisobola kutta kubanga oba already okitegedde. Tugenda kuwummulamu katono bwe tukomawo ne Dr. Mwesi omusawo w'amagumba tugenda kwogera ku nzijanjaba management. How can we manage? Tweyamba tutya, twetangira tutya ensonga zino. Katukomewo.
Bethany TV for health. Exciting news for all viewers of Bethany TV. Bethany TV, the premier health TV channel in Uganda and Africa, and also your favorite TV station, is now on Star Times. You can now watch Bethany TV day and night, weekdays and weekends on Star Times, channel 271. Catch your favorite programs on health, wellness, entertainment, and so much more. Bethany TV is also available on free-to-air, GoTV, YoTV, Airtel TV, and Afro mobile apps. Not forgetting online via our website www.bethanytv.ug and social media platforms at Bethany TV UG. Bethany TV for health. Introducing Bethany TV, the pioneer health and wellness channel in Uganda and Africa, having a profound commitment to health and wellness. Our content takes various forms, from music and series to documentaries, talk shows, news, features, movies, cartoons, and reality shows. We are a hybrid station available on free-to-air and pay platforms, embracing the digital age as we maintain a strong online presence through our website, social media platforms, and mobile apps. Explore our rich and diverse content, engage with us on social media, and be a part of the positive change we aim to bring to the health and wellness landscape. Bethany TV for health.
Kyezikira ku Christmas zeda nadanga nkyali muto kwali kulia na kugenda muzune kweno Christmas particularly kyezikira mwaka sikyagujukira nalye mmere n'endya akabuto ne kakubako nekinde tirotulo kati ngenda okuzukuka nga bageze dda muzune bakomawo eyo Christmas sigenda kujerabira nze Prisnik akaikai presenter wano owa Sunset Lounge ku Bethany Television kwagaliza sekulu nungi ne omwaka omujja ogw'emirembe wano ku Bethany kyetwenyumirizamu ennyo kuba TV ya byabulamu era nkusuubiza ntujja kuweereza embeera zonna amawulire ebisanyusa bizimba naye nga byonna byetolerawo ku byobulamu bwo twagala obeera n'obulamu obweyagaza nabo abakwetolodde. Merry Christmas and a healthy New Year.
The Vachiga are those people that love to commune. Now, as a child, when I was growing up, it was a time when we would go back to the village, celebrate with our family, and get to enjoy the Christmas cheers. My name is Christine, and I'm the administrator here at Bethany TV, the first health TV in the whole of Africa, the place where you can get all programs that are related to the well-being of your health. As we celebrate this Christmas period, I would love to extend love from Bethany TV. Please stay tuned.
Bethany TV for health.
Tubalamusiza nnyo mwena abakatwegattako oli ku Bethany TV tulaba health morning ate twogera ku tulina segment gye bayita focus wetukubaganya ebirowoozo ku nsonga enkulu mu ggwanga muno. TV eno ya byabulamu eregesako okumanyisa abantu ku byobulamu bategeere. Bw'omala okutegeera ky'otegedde tekisobola kukukosa, ky'otamanyi kye kikukosa kubanga okumanya maanyi. Erinnya lyange nze Kintu Mutesaasira Senior ate negatiddwako Dr. Mwese Derek nga mukugu mu ndwadde oba mu magumba mu bujjanjabi bw'amagumba. Leero twogera ku ndwadde gye bayita Osteomyelitis in children, obulwadde obukwata amagumba mu baana. Ennaku zino bweriisa nkuuli kubanga baana bangi bafunye ebizibu ate ng'ebibirizireese obuzibu buno obutamanya bw'abazadde bweyongedde ate nabwo okulinya enkandaggo ekivaamu ne bakola ebitajja ate ne bakosa obulamu bw'abaana. Bwe twawummulidde twali twogera ku ani ali mu katyabaga k'okufuna obulwadde buno. Kati tugenda kwogera ku bujjanjabi oba ku ngeri gy'osobola okuziyizaamu n'okutangira, how to manage, kye tugenda okukwasaganya. Maaso awo tugenda kwogera ku repercussions oba side effects, kiki ekibaawo singa obulwadde bw'amagumba busajjuka mu butamanya, ng'ogenda mu basawo b'ekinnansi, ng'ogenda mu bantu abatali bakugu, mu kifo ky'okugenda mu basawo ne bakukuba ebifaananyi ne bamanya ne bajjanjaba bulungi. Ogenda eyo olw'okuba ozimba eggumba ogamba olina ettalo ne bakusalaasala emisale ne bakussaamu eddagala mbutalo mbubavumula ki, kyokka nga n'abakusalaasala tebakugukako mu kusala oba mu kulongoosa. Be bakozesa tomanyi oba babyozezza tebabyozezza mu mazzi gookya, mu ddagala eryoza ebyuma ne biba nga bitukula bulungi nga tebiriiko buwuka buleeta ndwadde zino. Awo tugenda okutandikira. Era doctor, yes, management tutangira tutya, tuwonya tutya?
Kati management usually tutandika na investigations.
Okay.
Investigations mutusooka okulaba kiki, what are the which kind of infection
atuuse ku ddaala ki, obulwadde buno butuuse ku ddaala ki. Yogera mu Luganda doctor, abantu bwebakuwulira mu Luganda. Kati
mu management usually tujja tutandika n'okunoonyereza mulina buzibu ki kwe kyava. Tukola tests, mubamu laboratory tests, tukujjako omusaayi ne bakola CBC. Then in the CBC findings usually mubaamu nga like neutrophil levels are very high. We shall just get to know that there is an infection that is taking place, usually bacterial infection. Then tujja kukola ne what we call culture and sensitivity. Culture and sensitivity tukujjako omusaayi go, tukujjako swab wali eri wenyini awali pass eri ofuluma. Sagayogera pass mu Luganda
amasira, anti kati munaye tuli mu kujjanjaba doctor.
Amasira nga Mr. Kintu wayogedde, tujjako amasira ago. Then we take them to the microbiology lab for culture and sensitivity, balabe exactly bacteria ki. And then after we do also X-rays. Those X-rays for them tuba twagala kulaba gumba liri mu mbeera ki. Usually in X-rays, that's where we can find whether there are pathogenic fractures, whether there are sequestrums, whether there are newborns, whether there are multiple sclerosis, ogundu okubanga egumba libadde lifa. So you find that mulimu engeri ya clouds mugumba w'ekisoolisooli.
Ebyo tetubiraba na maaso.
Tusobola biraba.
Abasawo b'ekinnansi ne bano abakujjanjaba eyo bw'ogendako mu nsike tebabiraba. Ekyo kyuma kye kibiraba.
So oluvaawo tuba tusobola okukonfaminga nti ali mu stage wet osteomyelitis, either it has become chronic oba akyali mu stage ya acute.
Kikyotegeeza acute ne chronic.
Kati mu acute watandikira nti aba asobola okuwona amangu. Kati when it becomes chronic, that's where the problem is.
Obuzibu buba bugenze, kitegeeza buzze bukula.
Yes.
Ng'owonza kusigako kadagala wali we basala emisale bakusigamu eddagala ly'omusawo. Okay.
So kati whenever it has become chronic, obuzibu buzze nti healing usually delays to take place.
Okay.
Yeah, it can take place naye nga aiba n'obuzibu bumu nti sometimes it recurs.
Kikomawo.
Yeah, ekomawo. It's very hard to complete it gundi yonna nti bigweyo. So awo kyuva mumwavu okubanga bamuneminga chronic that it can recur kuba aba kizibu okuwona. Abamu abali lake awona naye kubatali lake it becomes complicated nti abanga awonye then ate after na recurringa like after like 2 months then it recurs kakananga kigenze kyeddingana paka omuntu nakula oba nekiliadinga into other complications tugenda oyogerako mu maaso side effects emu gundi obuzibu obuyinza obuvaamu ifatolo gundi ekigere kigenze kiddamu funa ekirikaringa ne osteomyelitis.
Doctor,
ka treatment after okumanya nti these are ali ku stage bweti treatment we can decide sometimes we give oral antibiotics sagala magayo olabe swelling yonna ndoza cause there are people doing self medication.
Yes,
there are some conditions whereby self medication cannot help you because I've seen that even as we go nti nobanga you have come to my clinic okubanga ndaba nti this is osteomyelitis by my eyes or by signs, still I need to go ahead and I do investigations so that I don't mess up with the treatment. So don't treat yourself so as over much ngendaba njogera kubimu oba
treatment tewefuula musawo gwe toli musawo era kitukigambanya abantu dokita nti mukama yeebazibwe nti oli ingeniya oli looya oli taata mulungi oli maama oli musirikale oba oli mulamuzi katugambe kale oli mubaka mulungi naye toli musawo kati ekintu kino ekyokwejjanjaba ne mukwata eddagala ne mulituuma ewaka kya bulabe kikoseza ddala obulabe emu ku birwadde ebisinga kati ebizibu ebiri mu malwaliro nti neddagala nga terikyakola bulungi mu bulamu bw'omuntu olina okyusa amadagala nga 6 kwejjanjaba bwafunamu akamuluma namira painkiller bwafunamu kali antibiotics ekifuba mira eddagala bweriti kyokka dokita tannamugamba kale kivaamu akoseza ekibumba. Yes doctor.
Yeah, so after confirming which stage, then we can do our treatment plan. Usually in treatment plan in acute, what we do drain that pass. We plan what we call for minor surgery. Netugenda, but when it's sterile, because remember we are removing infection, then we don't want to do what? To reinfect again. So make a minor surgery and you do aspirate, but when it is very, very sterile.
Okay.
So in aspiration, we are draining this pus away. Then watermelon cleaning, that's what we call I&D, incision and debridement. You drain. You drain and you leave that, you know, that the internal part is really clean.
Doctor, ng'omaliriza producer mpa ku masimu ago woba oyina ekibuuzo ekikwatagana ku ndwadde z'amagumba mu baana oba ku ndwadde z'amagumba kuba essimu tubuli egy'okubidde ekibuuzo kyo n'erinnya lyo doctor ajja kwaniriza era ajja kwanukula. Okay.
So kati oluvaawo nga tumaze okugyamu ago amasira, we dress the wound, then omulwadde ne tumuza ku ddagala ery'okumira eri antibiotics so that the killing ezo bacteria ezandibanga zisigaddemu. So oluvaawo we keep monitoring era jjanga for review n'olaba kujjako wabanga alemeredwa nga agenze mu chronic stage, awo then wagenda mu chronic stage kyetudda eba major surgery era eba ya debriding, you drain era kati nosalira ddala nemutuuka ku gumba. We do what we call sequestrectomy. Sequestrectomy is like removing all the dead bones.
Wow.
Yes, so you debride, no jam pass, no cleaning, no jako all the sequestrums. So now no cleaning a kugumba. Then after cleaning the bone, ngera you cover, ngera client over patient mumuza kuchi ku antibiotics.
Bomujamu amagumba muzamu ki byuma
ano tetuzamu magumba kujjako those ones who need what like those ones who have had pathogenic fractures nga even there is limb shortening ngegumba litandise impala nsonga ligenze likendeera we do what we call a bone graft tuyinza okukwata one part of a bone ku magumba agali normal. Usually we use the fibula singa baterina buzibu. We use the fibula, then we do bone graft whereby if at all it has been a long bone. Yes, yes, netusalako netukozesa. Then sometimes we use the hip bone kubasala piece, then nebakavalinga part no buzibu. So after we can even do skin graft. Senganti, remember, if at all producer can show to us some pictures of a limb severely affected by osteomyelitis, find that ne shape y'omubiri etandise okukyuka. So we do skin graft. So like that part, you find that the bone eri kungulu enyama yaggwawo. So we do skin graft no coveringa mweyo part
mufuna enyama ne mugisaawo.
Yes, okugezaako okukomyawo shape y'ekyo ekitundu ebyo. So senga tugenda nebanga kubanga alina waba mu chronic alina tendency erikalinga era to keep on monitoring wabanga era alikalinze, then we reorganize naddayo mu theatre mpaka mpola bwatyo.
Doctor, what are the side effects? Biki ebivaamu singa embeera esukka omulamuzi?
So ensenga embeera esukka omulamuzi eyimu ku effects eziva mu osteomyelitis mulimu okutemwako ebigere.
Wanje?
Muba mutemwako ekigere oba omukono oba ekitundu kyonna
ng'embeera esusse.
Yes, ng'embeera esukka
eri mu chronic.
Yes. Kati olwalikalinga ennyo, you find that bone egenda tuukayo nebeere eaten up. Omuntu akyasobola gisaako bweti nga yenafuye, ekigere kinafuye, obanga n'oluusi eggumba mwekyo ekitundu almost ligenze likendeera, terikyasobola wanirira weeti ya mubiri oba terikyasobola kubanga ligasa omuntu ono, naye ng'ate limumalaku mirembe.
Osteomyelitis ayagala kufaana, chronic osteomyelitis ayagala kufaanana mu kansa.
Kangambeera bifaanaganamu kubanga n'osteomyelitis naye era eggumba agenda lirya mpola agenda agaziwa mu bitundu, agenda tugeze watandikira wansi w'eggumba agenda oluusi oba ayambuka oba agenda asaasaana kwekyo ekitundu ky'eggumba kweri eggumba lyaba ali okulya. So find that it will go on spreading throughout that bone. And whenever it is spreading, it will always leave the same effects there seno wansi. That means wegende gumba lifa. You get. So ojja kulaba nga wano wansi watandikidde but will go on expanding ngedda waggulu oba ngedda wansi kugamba kusasana kweri eggumba. So ojja kwesanga nga kati option endala eriwo ngolaba the limb has lost shape lwansonga amagumba terikyayenkana munda. It's not equal. Side yemu nene endala ntono, endala eriribwa endala inafuye. Fractures fuuse fractures. So usually they opt for amputating that limb ne bakitemako. Then usually the deformity, like it will cause a deformity. Nti ojja kulaba someone nga the normal shape of the limb cannot be seen. Kitegeera nti eggumba liriribwa lyonna kati ne shape y'ekyo ekitundu tekyalabika bulungi. So it will the deformity, it will cause that deformity nti a limb nga it's not that fine oba nti omuntu wakulaba nti oba olina obulemu. Those are some of the side effects. Then other side effects can lead to contractures of joints. Nti eyinza okukata long bones like femur or tibia eyinza okwambuka mpaka in a joint.
Okay.
When it spreads into a joint, that means it can easily lead to a contracture in a joint. Nezino joints zijja kukola ki locking, you end up someone nga joint enyingo tekyazanya, you get sahanga producer watulaze kyekifaananyi kati olaba nti awali omusaayi, those are sinuses. Then when you look at these x-rays, you will see that there are pathogenic fractures. If at all you can see that waliwo waneeno wakati eggumba wegamenyekera oba wetegereza ku x-ray eri ku screen. Then wolaba ni waneeno wansi nga ankle joint ku kifaananyi ekya wakati nawo waliwo another pathogenic fracture eggumba nawo lyamenyeka. So when it goes on like that, ojja kulaba nga a limb has lost shape, a normal shape. Ojja kulaba nti omuntu newaba kati atambuza ekyo ekigere tasobola kitambuza bulungi, aba awenyera oba abawulira obulumi bungi.
Kati Doctor, kiki kyewandikubidde omulanga omuntu bw'alaba obubonero buno wammanga adduke mu ddwaliro?
Usually omuntu oba olabye buno obubonero
kasita ozolaba nga okugulu joint zizimbye oyinza olaba ekigere waliwo ewantu ewazimbye, dduka mu ddwaliro ki ery'amagumba oba eddwaliro neryo ndi okumpi?
Kiba beta n'ogenda mu ddwaliro ly'amagumba ogenda osanga omukugu eyakugukamu ekyo ekintu
okuba nti nagwo tegalabika okumanya nti wano waliwo eddwaliro ly'amagumba wano mwegali
matono naye mwegali. So
obulwadde buno buwona?
Obulwadde buwona obanga omuntu abwanguwiridde. Banga lino lyonna lyomala ng'ogenda mu basawo bakulyako ssente, abasawo Abaganda
babakinansi
ababekinnansi
kubanga ne mwakyoli gyebera mugyebali ssebo.
So obudde bwonna bwomala ng'ogenda mu basawo b'ekinnansi genda olabe omusawo w'amagumba alabe ekituufu kyekyokukola kyekyokukola. Ojja kulaba nti eggumba eryandibadde oluusi nga n'infection tenaba olabye ekigere kizimbye oba omukono guzimbye. Mu kifo ky'okugenda mu musawo w'ekinnansi mbw aye banaye lino ttalo
bandoze
bakuloze
nalinye simanya
bakusazesaza obugiriti omwana bamulungidde mulumya. Genda olabe omusawo w'amagumba, genda amalwaliro g'amagumba.
Doctor, kamera yo yeeyo ekisembayo kyondyagadde okumalisa nkyo?
Amannya nsigadde ndi Dr. Mwes Derrick, ndi musawo mukugu w'amagumba kuva ku Osteomyelitis Services. Currently lyakyusa erinnya baliyita PAL, Orthopedic Services. Najja nankumbi opposite FDC oyagadde okundaba onsanga.
Okay.
So kati abantu kyenyinza bakubiriza ku osteomyelitis oba olaba nga olabyewo embeera yonna ku kyenji y'ekitundu ky'omubiri gw'omwana wo oba gwe kennyini omuntu omukulu wazimbye wookya nnyo, laba omusawo w'amagumba, genda mu kiliniki y'amagumba bajja kuwa obujjanjabi oba bajja ku advisinga ki ekirina okukolebwa ekituufu. Kifo ekyo genda musawo w'ekinnansi.
Alright, tuyanza nnyo oyo Dr. Mwes Derrick musawo w'amagumba. Erinnya lyange nze Kintu Muteesaasira Senior. Tulabagana olunaku lw'enkya budde bwe bumu ssaawa ze zimu, weekuume, weeraba.